Haruhiro Inohue is a world-renowned surgeon and gastroenterologist. He is a professor at Showa University School of Medicine and director of the Digestive Disease Center at Showa University Koto Toyosu Hospital in Tokyo, Japan. He pioneered the development of minimally invasive gastroenterology procedures such as endoscopic mucosal resection and peroral endoscopic myotomy, POEM. For his work in the field, he received the Pioneer in Endoscopy Award from the Society of American Gastrointestinal and Endoscopic Surgeons in 2011. Today, he'll be presenting the lecture, POEM Opened the Door of Third Space Endoscopy. Ladies and gentlemen, please welcome Professor Haruhiro Inohue.
So thank you very much for your kind introduction for me. And I'd like to say congratulations all the team who established this very nice platform for medical education. So I would like to talk about the POEM update 2020. I say the Professor Novice for your introduction of the importance of a high-resolution manometry in this field. So next slide, please. So this is my COI. Next, please. So this is the first report of the peroral endoscopic myotomy POEM procedure for treatment for esophageal achalasia. So this was published in 10 years ago in the Journal of Endoscopy. Next, please. So myotomy itself reported by Dr. Heller 100 years ago. So now we can do it using flexible endoscopy. Next, please. Please, yes, thank you. So this is a report at the time of 500 cases in our hospital. We submitted data to American College of Surgeons. That was 5 years ago. Next, please. Yes, this is the, please note the date of the record 2008, 12 years ago. That was the world first case of a POEM. We placed the mucosal incision in the anterior wall of the esophagus. Next, please. Then after creating submucosal tunnel, it's a working space. Now we are cutting the circular muscle. Next, please. Yes, so this image is the right after myotomy. So bottom of the image, bottom is the mucosal backside of the mucosal tube, and the top is the myotomy. Next, please. Then after completion of the myotomy, we close the mucosal entry using clips. The junction is already open. Next, please. Before and after procedure. Next, please. This is the Eckart score. This is a symptomatic score, and the dramatically improved after procedure. I met the patient 8 years after POEM procedure, and actually he gained 20 kilogram. Next, please. Yes, the patient satisfaction is 100%, and he has no reflux symptom. Next, please. So far in our hospital, we performed the POEM procedure more than 2,000 patients. Next, please. So point is a myotomy length. Next, please. So in the case of a classic achalasia, Chicago type 1, so it's a relatively short myotomy, focusing on the LES dissection. Next, please. And then, after completion of the myotomy, smooth passage of the volume. Next, please. So, like this, in the case of a vigorous achalasia, so we have to place a longer myotomy, including the dissection of upstream. Next, please. Then the volume pass very smoothly. Next, please. So this is the myotomy length, myotomy site based upon a Chicago classification, but it looks a little bit complicated. Then we can summarize. Next, please. Category 1 is that we can alone, and the extended myotomy for Chicago type 3 achalasia. And then in the case of a diffuse spasm or jacama esophagus, we can preserve the lower esophageal sphincter. Of course, we have to confirm the normal LES function by high-resolution manometry. Next, please. So Dr. Caridas and Pandolfino, both of them Chicago type 3 achalasia. So POEM is the best indicated. Next, please. Results of the POEM to spastic motility disorders is good. So like this, 70–90%. Next, please. Next slide, please. Yes, thank you. This is spasm. Like this. Next, please. So left-hand side, you can see abnormal contractions of the esophageal body. So volume stay in the esophagus. And the one click, please. Yes. So after POEM, the volume pass very smoothly. Next, please. So try to preserve the lower esophageal sphincter. Next, please. So this is the actual video clip. This patient, we can see abnormal contractions in the body of the esophagus. This is a diverticulum. Anyway, so next, please. In this case, we perform the POEM and they try to preserve the next, please. Yes. Then we place the myotomy onto the esophageal body like this. So in this case, the muscle layer was very thick. Next, please. This is the beginning of the lower esophageal sphincter muscle. LES itself are very thin, so we try to preserve it. Next, please. Okay, next, please. Proximal site, yes, site is already done. And then this is the symptomatic score improvement, perfect reaction to the treatment. Next, please. So far, lots of publication demonstrate a very good results, but a potential problem of the POEM is the GERD, 50% risk of reflux. Next, please. So in order to avoid it, in order to prevent it, we can do several things. So most important is a double scope method. Next, please. So we insert the two scopes during procedure. This was first reported by Portuguese doctor. He or she must be a Portuguese doctor. Next, please. So like this. So a pediatric scope is in the stomach and keep Letoflex as a monitor of the submucosal endoscopy. And then we control the dissection of the gastric myotomy 1 to 2 centimeter, short myotomy, onto the stomach. Next, please. Fine. Next, please. So yes, this also demonstrates RCT. Less than 2 centimeter myotomy is enough on the gastric side. Next, please. So another technique is a POEM+ fundoplication. Next, please. So we reported it to the Journal of Endoscopy. Next, please. So world first case of a POEM+ fundoplication endoscopically was done in 3 years ago. Next, please. So far we did 43 consecutive cases. Next, please. Okay, next, please. Like this, we get in abdominal cavity through the esophagus and then make a fundoplication like a doll. Next, please. Yes, we demonstrated at the time of ESGE days in a plaque. Next, please. We use a hand suturing device. Next, please. Like this. We get in an abdominal cavity through the submucosal tunnel. Next, please. And then place the suturing onto the anterior wall of the stomach. Next, please. Okay, then make a fundoplication. Next, please. Usually we place 2 stitches. So this is actual video clip. In a submucosal tunnel of the esophagus, now we are dissecting the peritoneum. And then behind you can see a back side of the left liver lobe. And then get in abdominal cavity. Next, please. Okay. Then we open the peritoneum widely and then get next, please. Now we place the suturing onto the gastric anterior wall by our suturing device of the flexible endoscope. Next, please. This is the pediatric scope view. So needle is coming in the stomach and then next, please. So this is a proximal anchoring. So we place a suture onto the left crus. Next, please. Then we can make a fundoplication like a doll. You can see a nice folding. Next, please. So technical success. Next, please. So pH monitoring demonstrate the improvement, statistically difference with. Next, please. So this is my last slide. So ladies and gentlemen, so now we can perform the POEM+ fundoplication using a flexible endoscope. This procedure is very similar to Heller doll fundoplication. Next, please. Okay, next, please. Next, please. Yes. So now we can perform the many procedures using the flexible endoscope. That is my conclusion. Thank you very much for your kind attention.